More than 50 years ago, the FDA approved the first oral contraceptive in the United States, and since then, contraceptives have been controversial for some Americans.
In the state of Connecticut, where an old Comstock law making it a crime to practice contraception is still on the books.
In the 1960s, James Norris made the first complaint against a clinic offering birth control. That eventually led to a landmark case in the Supreme Court about access to contraception.
Well, I'm 100% against birth control because it's immoral. It's the same as prostitution or abortion.
I naturally didn't want to see women take all the suffering of childbearing and of pregnancies.
While their medical uses aren't in question, and many women in favor of access to contraception say the medications are critical for women's health and preventing unwanted pregnancies, some say there's a moral argument against using contraceptives, and laws related to access to contraceptives have sometimes been labeled as an attack on religion. In 2012, the Obama administration approved a mandate for employers to provide contraceptive coverage without out-of-pocket costs as part of the Affordable Care Act. 7 years later, the Trump White House wants to roll that mandate back nationwide and allow nearly any employer with a religious or moral objection to opt out.
A believer should not be forced by the government to have to choose between following his faith and following the law.
We are the majority vote! We are the majority vote!
But women's health advocates are bracing for a fight.
And my pledge today is, our doors stay open!
Despite the legal fight, the U.S. has extensive contraceptive deserts, the lack of access to at least one clinic that provides the full range of publicly funded birth control methods. Data gathered and tracked by Power to Decide, a nonprofit focused on women's health, shows Texas, the Dakotas, Montana, and Nebraska with some of the hardest access points around the country. Ginny Ehrlich, the nonprofit's CEO, says even some women living in large cities need to drive for hours to reach a health center that provides what they need.
When women have the opportunity to decide if, when, and under what circumstances to get pregnant, they have more agency and control over their lives, and the next generation does better as well. So we know that access to contraception really contributes to that. And in fact, the vast majority of unplanned pregnancies can be avoided if women are able to access the contraceptive method that works for them.
The Title X family planning program is also under scrutiny, a top priority of conservatives who helped elect the president. Planned Parenthood is its biggest beneficiary. It operates about 41% of the 4,000 Title X clinics in the country.
That's why this administration will work with the Congress to end taxpayer funding of abortion and abortion providers. And we will devote those resources to health care services for women across America.
20 states have sued the Trump administration for what they see as wanting to shift millions of dollars from Planned Parenthood towards faith-based clinics. Despite facing an unprecedented number of lawsuits and lower court losses, the Trump administration is betting big on the Supreme Court to uphold its controversial policies.
Hi, I'm Elahe Azadi, pop culture writer at The Washington Post. Real journalism matters. Subscribe to our YouTube channel to get our latest reporting and analysis.